Shalina, baby brings this segment and we're talking postnatal depression. Now, many probably can resonate with that because it is a common problem affecting more than 1 in every 10 women within a year of giving birth. And of course, it can also, believe it or not, affect fathers and partners. So men, I think you also need to listen up to this segment because it's important to obviously get the help as soon as possible if you think that you might be depressed, as your symptoms could last 4 months. And of course, if it's not treated, what happens? It could get worse and have a significant impact on you, your baby, and your family. And that's the last thing you want to do when you have a little bundle of joy that is there to absorb all the energies that you have to give off. And of course, through observing you, being around you, that's how they then pick up things and learn many things. And to talk to us about this topic, we'll welcome one of my favorites, Dr Nazia Iram Osman, back to Urban Women. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam, Razia. I think my first visit for 2024.
Oh, really, hey? Allah Akbar, the way time is flying.
Alhamdulillah.
For me, it's just like really 2024. And even though I say the date every day on radio, when I go to my practice, I'm like, what's the date today?
What's the year even?
What's the year? Absolutely. Now, Nazia, you know, we get depression, we get postpartum depression. What would you say is the difference between normal postpartum blues and postnatal depression?
Okay. So we call them the normal baby blues,
yeah.
which is, there's so many hormones in the female's body and her body has gone through so much, and we all have this idea of what we want our birth process to be like. Or our baby, of course, I don't know why they have that term sleep like a baby, because babies don't sleep well. So within that first few days, whether it's hormonal, whether it's whatever going through our body, whether it's that sleep deprivation, whether it's because your plan, you didn't go according to plan, maybe you wanted normal, you had a C-section.
Yeah.
There's some sadness, usually that gets worse around the 3rd day. So that's normal, that you're a bit more touchy or you cry a bit more or, things like that. Not to the point of you want to harm yourself or you want to harm your baby. That's something else. But in terms of time, duration, intensity, it's there. It's just a bit moody, shall we call it.
Okay.
Right? So that's normal.
Okay.
Then there's it's an adjustment phase where maybe you had more time as a couple, or you didn't want to spend that much time with your mom, but now you have to go for your hours, whatever in that space. So those are the normal adjustment sort of things.
Correct.
But let's just say beyond that, if we're looking at postnatal depression, we're looking at a timeline of more than 2 weeks. We're looking at intrusive thoughts of wanting to harm yourself, wanting to harm your baby, or just not attaching well. I mean, it's like, I just don't want to spend time with this child or take this child away. It's just not really connecting, this coldness that comes in.
Yeah.
But it has to be for a prolonged period, not like I've had a C-section, I'm in pain, a bit more than that.
Right.
So it is the normal symptoms of depression: change in sleep, change in appetite, change in self-esteem, low mood, which would mean anger, irritability, lowered frustration threshold, or just crying all the time.
Right.
Not feeling like you're equipped as a mom beyond, the normal doubting. So it's that kind of flavor, the postnatal depression. And though we say 1 in 10, I actually think those numbers are a whole lot worse.
Okay.
I think there's so much of shame and stigma because everybody assumes you're going to have your baby. And the weird part is, Raza, it affects those, like just say, for example, you couldn't fall pregnant. And after years now you fall pregnant, all of your duas have come right. And you think, I'd be blissfully happy.
Yeah.
And it's sometimes those kind of moms who get it, or those moms that have been through a struggle.
Okay.
For whatever reason, their body responds with this kind of drop.
Right.
So there's so much of guilt around
and then
it.
it probably hits then.
And then they're so guilty that how can I be going through this, or why am I not attaching? So they probably won't even speak up.
Right.
Because they themselves are so shocked or not knowing what's going on, or in doubt of their own, like I'm a bad person, not that I'm going through depression.
Wow.
So I think the numbers are much worse.
And it's just not recorded.
It's just not recorded. Most people will just pass through it, not go for meds. Because these numbers are the ones that are recorded because people came for help.
And that takes a lot of courage because it means, I want to live in a better space.
Yeah.
And I think because many that may not open up, it's probably because they hear, what's wrong with you? Why? You shouldn't be feeling like that. The normal
Absolutely.
statement.
There's so much of shame.
Yeah.
You shouldn't be. Snap out of it. It's all in your head.
Yeah.
Make sure you got a beautiful child. What's wrong with
What's
you?
wrong with you? But these are so real emotions. Just listening to you, I haven't really seen somebody go through it after giving birth, but these are real things that people face, and we have to obviously be sensitive because nobody wants to just feel that for fun.
A lot of my moms, I pick it up more in retrospect, where they've come months later and maybe they've bonded with their child now they're speaking, or they've just realized or they come as a couple, and the couple months later have gone through this really heavy phase, and then I have to go back to tell me about the birth of your child, and then we realize, hey, that was a depression, that's why she was fighting more, she wasn't being cruel to you because she couldn't stand you, or whatever, then in retrospect it's so much easier to see, 50-50 vision from that point of view.
Look at that, it just shows we as human beings so much more to us, and how we may analyze one another and just think they're being nasty. So Nazia, would you say that some mums are more at risk, and also what can be done about it?
Okay, so sometimes it can be that postnatal depression can be pure hormonal because of the progesterone or whatever it is, certain chemicals leaving the body.
Yes.
Even with everything being in place, a woman can have postnatal depression.
Right.
But that being said, more common is that there are certain factors that will make for depression. For example, if she has a lack of social support.
Okay.
If she's maybe dreading going to the home where they're going to be taking care of her. If she has a troubled marriage. If she has a low self-esteem. If there is family history of depression, or she herself has had any other diagnosis,
right,
anxiety, OCD, or even depression,
right,
all of these make for worse. Also, difficult pregnancy, difficult even falling pregnant, the birth plan not going according to order or whatever it is. All of that,
especially when you want to be in control.
So certain type A personalities usually also struggle with this, because how dare my body not listen to me?
Yes.
How dare I have not be able to even do it without an epidural or whatever. So it just depends on the temperament, the personality, but also the environment. I think the environment plays a very big part, because as hyper independent as some people may strive themselves to be, or independent, whatever that that their comfort level is, when you have a child, your body, you need care.
True. And
you need help for your baby, and
so true.
It can be a struggle.
Wow, that's why Allah Azza wa Jal gives us that 6 weeks after that.
Absolutely.
Take time off, your
and
body
no matter
needs
what
to
the
heal.
culture, no matter the religion, it seems there is this period that is universal, that
Correct.
they say, take care of the mom, the woman around the family gather, and they take care of the mom and the child, because a child is born, but a mother is also born, right?
That, hey?
And even 2, 3, 4, each child is different. Each version of the mother is different.
That's so true. Hey, I mean, like 5 fingers, they're not the same.
They're not the same.
And it's the same with children. So, Nazia, how would you say, how is postnatal depression then treated?
Okay. So psychotherapy definitely can help, because the moment we even make the diagnosis, we lift the load off and we go, this is not you being a bad human being, this is not you being na-shukr or ungrateful, it is literally that this is a medical condition, or this is a psychological condition, and then we start rallying support. Like if I pick up the diagnosis, I will call whoever's the closest family member, whether that's the mom, the husband, and go, this is what we're looking at here, these are the symptoms, you don't personalize her, now let's work as a team to support her.
Yes.
And
support is huge.
And there are medications that you can actually give that will help even with breastfeeding, because body and mind are so intrinsically linked.
Correct.
So there's definitely medication that can come in very early, even if you are breastfeeding. Some people think if you're breastfeeding you can't. There's no such thing.
Right.
But even before we go into meds, usually when the support system kicks in and she stops feeling bad as a human being, sometimes that is enough. But if it's more than that, like just say she's starting to see things like she's becoming psychotic, or she's at risk, or she's having these horrible thoughts to hurt herself or baby, then we quickly come and bring the medication in, or we need to hospitalize her. I don't know if this is the term, Jano. Do you remember that term? Did you not hear the word Jano? So I hope our listeners can confirm for me. There is a term, I'm not sure whether it's used, in which, but I know it's an Indian culture term, where when postnatally the mum starts losing her mind, shall we call it, and seeing things, or people would say bad wind or whatever. But it can be postnatal psychosis, which can be because of the mood not being treated.
So it's so important, because if we have to just sum it up, awareness.
So these things were around. That's why I look for that old term, because these things were around.
Correct.
But they were possibly allocated to other things.
Yeah, and then you're not getting the real help. And then what happens?
Help.
And I suppose then the stigma and everything comes in. And then there's just no benefit or gain. So alhamdulillah,
people are more comfortable saying I'm not saying it can't be bad wind, shall we call that? But people are more comfortable saying bad wind than saying, hey, this is psychological stuff. This is actually pretty easily treatable. we can own that. Maybe it's a combination of both, but reach out.
True.
Just as you would reach, like if you have any physical condition,
True.
even if you have a headache, we don't say that's all in your head, snap out of it.
Yeah, and
we'll
that
say
you-
reach out for help,
Correct,
right?
correct.
And
And
treat
no
it.
shame. You're right. Many people feel like there's something wrong, or I did something, or shame. It's just part of the journey.
It's
part
just-
of the
in fact,
journey.
now we're coming up with different theories about it, that a lot of psychological conditions have a physiological basis, whether it's hormonal, whether it's inflammation of the brain itself. When people are not well,
Yeah.
of course it affects their brain.
Yes.
So who says you can't have illness of the brain? And that's not what we're looking at, psychological conditions. So
True.
somehow there's less shame in that.
Yeah.
Whatever it is.
It's medically done. Yeah, absolutely. So, I mentioned something in my intro. I said fathers can also feel it. Postnatal depression. Expand on that. Tell us
Okay,
how.
so
What's
this
going
now,
on?
I'm like putting a copyright disclaimer and all the rest of it. I need to write a paper
Noted,
on this. Because there isn't a lot of data to show that fathers have postnatal depression. But it just happened a few years ago that I ended up with 2 fathers at a very close time. And the thing that was in common with both of them, that prior to the wife falling pregnant and having a child,
Yeah.
they both were not depressed. And then came depression. And I was looking into it. Could it be that the wife is giving less attention, or there's something in... And it wasn't. It was
Right.
an existential crisis that I haven't achieved my own dream, so I'm not where I want to be. Can I provide for my child? Am I
Typical
good
for
enough
males.
as a father?
Yeah.
And they came up within the time period of depression, within that birth period, and for longer than 2 weeks.
Look at that.
They had that classic postnatal depression. And I realized, and I looked more into it, the fathers can also have postnatal depression.
In their own way,
They
yeah.
do mimic symptoms sometimes. It's
That's
called...
true.
what
I've
is
heard
that?
about
The, I forget the term. But where you also have the pregnancy related, like you can have a craving and you can have backaches. So why
I've heard
not
about that.
have postnatal depression?
Why not? It's part
Why
of the
not?
package,
You
right?
can. Sympathetic pregnancy. There we go. So you can also have postnatal depression in dads. There's again nothing to be ashamed of. We go back and we look at what is your support system, what are your fears, because most of them at that point feel I'm not good enough or fit to be a father.
True. Very
You
true.
know, so we work through that with them, and if meds are required, we do good. But if you come for therapy, not necessarily you're going to get shoved, meds down your throat.
Yes, not
we will
necessarily.
try first.
Yes.
Unless it's really hectic symptoms, then we send you down for medication.
100%. You know what? Because of time, but I want to share something that there was a study where this lady was pregnant and the fetus was just, obviously acting up. So they found out, okay, how's the mum's psychological state? She was fine. And then they found out that the dad, who was in another city, was actually going to be retrenched. And this fetus
the child
was
felt the
picking it up.
anxiety.
Yeah, so
Wow.
it picks up both mother and
Yeah.
father. So why wouldn't the father also feel it and be part of this whole experience of this dynamic? It makes so much of sense, but it's so much deeper. So fathers, listen up. Hey, if you're feeling anything, just pay
valid.
attention.
It's valid.
Yeah, and
Absolutely.
don't ever think there's something wrong. I think it takes a lot of courage and it shows a lot of bravery when somebody takes the step to want to help themselves.
Yeah.
Because it's just like if there's something wrong with you, as you said, physically, you'll go check it out. Nothing wrong. What do you say if you suspect that a loved one has postnatal depression, and what can we do to also help?
So look, if you notice that someone is looking like they are more distressed than usual and they're not able to cope, first you might want to just practically help them out a bit more. What can I help you with? You seem to be struggling.
Yeah.
Offer them a safe space. Don't be afraid of bringing up these things, but don't offer therapy like an insult. Something's wrong with you. You need to go for therapy.
Yeah.
That's going to close that gate. It
Sure.
might be, hey, do you want someone to talk to? First line might be an older sister or a cousin who also has a child
Yeah.
who's maybe been through something like
Can
that.
relate.
And then if that's not working, then you come up with any other new moms, and then you come up with, hey, have you thought about therapy? Help them up, set it up if that's what they need, because the admin of it might be too much.
True.
Be practical in your assistance. Maybe you
Yeah.
want to pop in and help with her child. Don't tell the moms what to do when they are already in that state of
It
mind.
can be so overwhelming.
It can be so
yeah.
overwhelming.
Yeah,
Like, why
true.
aren't you putting this powder or that? No, help her
And it's
out.
like you're already going through so much and you're being judged.
And she's already probably overwhelmed. So if you can
Yeah.
practically help, if you think therapy is required, help her with making the appointment, sort it out in that way. There is no shame in reaching out for help. Plus, therapy doesn't have to be a forever thing.
Yeah.
My job is to literally just
That's
get your
beauty.
lifestyle back in order,
That's beauty.
reconnect you with the family members who are going to be that support. and
And
then we
enjoy.
back off, and then you enjoy.
That
Sometimes
bundle.
it's literally just 2-3 sessions and you're good to go.
Yeah, as opposed to prolonging it. And
As
then
opposed to prolonging it.
other
So don't
things
think, oh,
happen.
they're going to catch me and then I'm going to put on this. And you're just making big stories. Like,
Absolutely.
you're not feeling well. Come out like you would go to your GP. You wouldn't think 10 times to do that. Come, get an assessment, see what it is.
Absolutely.
Get the support.
So important.
And
So
you're back
important.
on
And know
bandwagon.
that there's this little being that now needs you and needs you in a good space as well. So in a nutshell, is if you see somebody with postnatal depression, be part of the solution, not the problem. Because
Absolutely.
often I think we become very judgmental, and I think that also
And that
feeds
makes the
our
stigma
ego
even worse.
because it
Yeah.
makes us feel better. Like, look at you,
Yeah.
but that's not how we should be, especially in our deen. Finally, Nazia, in about a minute, any advice for our awesome urban woman listeners, please?
Yeah. So, I mean, I think, as I said, don't feel shy to reach out. Be part of, as you said, part of the solution, not the problem. As always, break the stigma. There is no shame. Please, really, there is no shame.
True.
Reach out and be part. And if you've been through something, don't feel shy to share your story. But you'd be shocked at how just sharing how you feel could open up the space and for vulnerability. And others could also come, hey, I've also been struggling with that. What worked for you?
Correct.
Well, I'm going through it, but this is what seems to be when it's lighter.
How wonderful. And then you can help other people.
Then you can help other people.
So if you do have a story, don't feel shy. Let us know. Let us know on our WhatsApp number 0609041056. It will be lovely. And if we need to extend more on this wonderful topic, because it is very much a reality, we can always have our fabulous Dr. Nazia Iram Osman back in on Urban Women. It was lovely having you here as always. Time for a break, but we'll catch up with you again soon. Until then,
Inshallah.
Assalamu alaikum wa
Wa alaikum
rahmatullahi
salam.
wa barakatuh.